We've been undertaking reforms in our healthcare system. We have been looking at the total restructuring of the healthcare system. We have built 20 pilot PHCs, primary healthcare centers, and with those pilot centers, we want to expand to all the wards in the state. The whole idea is that the main care will be at the basic healthcare level. We need to have referral centers, referral hospitals, where patients who can be treated at the basic healthcare centers will now be moved to. And that has informed us looking at where quality secondary care can be offered to citizens. You also realize that we have one of the main issues that confront healthcare in this country is who pays. Up till now, there's been no comprehensive system where people save for their health needs. So we've introduced and passed it to law the Edo State Health Insurance Law, which makes it compulsory for every citizen in Edo to save towards their healthcare requirements, just like we've done in the case of pensions. But for healthcare, it's going to be everybody. Pension is for those who are working in government institutions and parastatals. So with the plan in place, the challenge that healthcare used to face in the past, which is not enough funding, enough capital to maintain infrastructure, to pay for quality human resources and personnel, hopefully will be dealt with. And so for us as a government, you can't ask people to pay for this kind of quality of care. That's one reason why we're looking around to make sure that the basic healthcare centers provide quality care, and then the hospitals are referral centers. You can't come into a hospital like this in future to treat malaria or to treat basic illnesses. That should be taken care of at the primary level. So when you come in here, you're doing more diseases that cannot be dealt with at the primary care centers. I'm very disappointed. I mean, this hospital is less than 14 years old, and you can see clearly there's not been any serious work at maintenance. And with medical facilities, like most other public assets, if you don't maintain them, they'll fall apart. So I'm really shocked that if we had a facility like this, we didn't think of expanding it, of improving it, of upgrading it, and we started building something we call 5-star. I'm really shocked. I didn't realize that so much investment was poured here in the first place 12 years ago. Why we have not optimized them, I don't know. Look at the IC units that were just left to fallow. Today, they are unusable. Well, clearly, yes, I just spoken to management. We are looking at areas where there's duplication between this facility and General Hospital. You realize that most of the buildings in the General Hospital are very, very old. We're looking at consolidating the services provided in the General Hospital in this facility. So we'll pull down all of those old buildings and then get private investors to now come and invest in state-of-the-art facilities, specialized facilities like oncology, like cardiology, things that, at this point in time, our budget may not be able to support, such that we begin to deal realistically with this challenge of medical tourism. Some of those facilities that people go and receive treatments abroad, we want to encourage them to partner with them so that they can set up specialist care here and be able to show them and demonstrate to them that those facilities will be viable, because we will have enough data of patients and conditions from the primary healthcare centers through the secondary center. So with all of that data, they will be able to make informed decisions as to what extent of investments that needs to be put into healthcare. But underlining it all is that they now realize that, okay, if they have facilities here, or we invest in these facilities, somebody will pay for it. That healthcare is not going to be funded primarily from state budgets alone. Right now, people are paying. The issue is, what is the quality of the care they are paying for? The issue of inadequate staffing we're still looking at, because we have almost 200 doctors in our government hospitals. The issue is, how are they distributed, how are they utilized? I've always talked about waste. Let's first review and examine what we have before we now understand the gaps there are.
So what of training?
Well, I'm going there to the School of Nursing now to see the facilities and the state of the facilities there. We've done quite a bit of work with our consultants. They are working on re-accreditation. We just need to make some investments in the facilities. That's where I'm going to from here.